Are we considering how to get that vaccine to people who need it most? I want to share a letter that a health reporter from the LA Times posted. It's an email she got from a married couple in their 80s. It says in part, quote, "My doctor has advised no stress and anxiety, yet stress and anxiety is currently the only path to the vaccine. To play, you must have a computer. Most seniors do not." It goes on to point out that you need spouses or companions to drive you there. Seniors have trouble standing in long lines, and certainly those who don't have bathrooms. The bottom line, they're saying the current system isn't designed for seniors. In a country where we've got new billionaires, it feels like every week, billionaires who are working on rocket ships to take you to the moon, can't we figure out a way to get the basic needs to every American?
You know, you're right on the mark. And that is what is actually starting to happen. There are health organizations that are targeting just these very kind of individuals and how to get them the vaccine. Remember, you and I talked about this several weeks ago. When the Operation Warp Speed activity took place, it was a magnificent example of science and research and manufacturing capacity all coming together to bring us these new vaccines. But the last mile and the last inch were not addressed at all. Basically, the plan was just dump the vaccine in the states. Good luck. And we have to, first of all, know how to get it out, just as we just talked about. But that last inch is critical. How do you outreach to the very people that don't have computers or that may be frightened of the vaccine because it comes from Operation Warp Speed? And so right now, the feet on the ground activities in our local areas that are so critical are reaching just these kinds of people, the people who are at highest risk, who may not even have access to getting to a clinic easily. How are you going to get them vaccinated? That's what's happening right now. Or the plans on the ground are actually being developed just for that. Wish we had them before, but we didn't have the support to do that.
In the beginning, you and I talked a lot about equity and the importance of people waiting their turn, right? There was Group 1A, Group 1B, Group 1C. But now that things have gotten so chaotic and people are so frustrated, they're losing faith in the system. Don't we run the risk that we're going to get towards an every man for himself? Who do you know? Who are you connected with? Where can I buy this thing?
I think that's true if, in fact, the system stays the way it is. But what you're going to hear about in the upcoming days, and as the president, I think, basically signaled, there are more doses coming per day than we had 2 weeks ago. The system now is much more streamlined. People are understanding, you know, that over age 65 means X. How many days will I have to wait to get my vaccination? And then moving it down to 55 from there. So you're right. It's going to be a challenge. People are going to get frustrated. I have so many friends and colleagues who are in that camp. But the bottom line is I wish we had more vaccine. We don't. We have to, though, be transparent to everyone out there. When can you get your dose? Many people say, I don't even care if my dose is 2 or 3 weeks from now. I just want to know I'm going to be able to get it. Right now, I don't know that. And I think that's what you're going to see changing over the course of the next days, is just people at least now knowing, when can I get my dose?
Well, we'll be getting an update from President Biden. He'll be speaking on COVID at 4:45 p.m. Quickly, before you go, your thought on the trend lines. We're starting to see more numbers sound like things are plateauing. Are you feeling optimistic?
Not at all. I think the very worst of the pandemic is yet before us. These new variants are going to be a huge challenge. Don't forget that when we were in April and we had 32,000 cases and we thought the house was on fire, it couldn't get worse, we got down to 20,000. Suddenly in July, we're at 70,000. Comes back down at Labor Day to 26,000. Then suddenly we get to 200,000. Comes back down to 150,000, and suddenly we get to 300,000. Every day we have a shifting baseline. What you're seeing right now, I think, is basically that dip that's going to occur before the huge surge. These variants are going to be a tremendous challenge for us over the course of the next 6 to 14 weeks. I'm not at all optimistic.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.